of my presentation and basically what this presentation will entail. Um, this is to give 16-year-old Abby Smith some brief information on one of her relatives who was recently diagnosed with an oral cancer. One of the first type of cancers that we'll be discussing is lung cancer. Lung cancer, since 1987, has been the leading cause of death in women, and it estimated to have been 26% of female cancer deaths in 2009. Among all the cancers, it's also the leading cause in men too. So actually, both men and women. There are two major types of lung cancer. The first one being small cell lung cancer, and then there's non-small cell lung cancer. So small lung cancer accounts for about 10 to 15% of lung cancer. Now, non-small lung cancer is divided into the adenocarcinoma, the squamous cell carcinoma, and the large cell carcinoma categories. That being said, non-small cell lung carcinoma makes up 85 to 90% of all lung cancers. Which leads to our next point. Let's start with signs, symptoms, and diagnosis. The signs of lung cancer just kind of depends on the type of cancer that you have and the stage. But 90% of patients will be symptomatic, unfortunately, later on in the process, basically. And that's common among most cancers. Now, on a later note, we should talk about management. You have a couple options. Three main options would be a surgical resection, chemotherapy, or radiotherapy. There are kind of a bunch of modalities that you can kind of pursue. It just kind of depends. The surgical resection. One of the next type of cancers we're going to talk about is breast cancer, and it's a common type of cancer, especially among women. Though men are affected by it, there's a much lower incidence. I guess about 12.7% of female currently born will have breast cancer, which is a pretty significant amount considering it'll happen at some point in their lifetime. And I guess there are some risk factors such as age, family history, and other things along those lines. But a surprising fact to me was the fact that the incidence is a lot higher in Caucasian women. But African women are actually more likely to die from the actual disease. But no matter what, aging is associated with increases of both incidence of death rates when it pertains to breast cancer. Now let's talk about signs and symptoms. Painless or painful lumps in the breast or the underarms. There could be some nipple discharge. There could also be thickening of the actual breast tissue or dimpling of the breast. There could be changes in your breast skin, I guess resembling an orange peel, and that can also occur. The recommended method, I guess, of breast cancer screening would be to start doing it basically when you're over 40, and you would basically go see a provider. And you would go ahead and have the mammogram done. Also, a CT or MRI could be done if indicated. Now, as far as management, there pretty much are different approaches, and you would kind of have to get with your provider. Of course, if you're in a stage 1, stage 2, it's going to be operable versus a stage 3, which means it could actually spread, and you would actually go ahead and pursue other avenues such as chemotherapy, hormone therapy, radiation therapy. And again, this would be discussed with you and your provider depending on the actual stage of your breast cancer. Colorectal cancer, the is the most common cancer diagnosed in men and women in the United States. And if you remember, the first one would be lung cancer. African Americans actually have the highest incidence of this cancer, and then Native Americans, Caucasians, Islanders, and Hispanics follow. Now, there is different types. though the most common type would be the adenocarcinoma, which originates from cells that produce mucus and actually lubricate the gastrointestinal tract. And this is kind of where it kind of manifests. One of the main risk factors would be someone who is over the age of 50. And then, there could also be that family history or gene alteration. So there's a genetic component to these incidences occurring. Now, let's go to signs and symptoms. It can vary depending on where the site of the cancer actually is. And it could be more of an acute presentation, which would mean there would be some type of obstruction within the colon somewhere. There might also be fatigue noticed in your loved one. And then, when they look at their labs, there could be a decrease in hematocrit. And these can all be initial presentations. One of the common tests would be a fecal occult blood test, which is used basically to diagnose how sensitive the blood is in the stool. Now, as far as management, it stands the same. It just kind of depends on the location and what stage it's at. Now, you do still have those 4 different types of treatments: the radiation, chemotherapy, the surgical resection, but you also have something that's called targeted therapies. Testicular cancer will be the next cancer we're going to tackle. It's pretty uncommon, actually, when you compare it to like lung, breast, and colorectal. There's about 8,000 cases, maybe, diagnosed per year. And this is more of a disease process for the young and middle age. Some of the risk factors could be family history, which, has been one of the risk factors for pretty much all these. But also HIV and AIDS. That's a little bit new as far as when it comes to testicular cancer. And this tends to manifest between 20 and 54. And Caucasian men are actually 5 times higher to have and develop testicular cancer of a chance, basically. Next, we'll just talk about the symptoms. You can have a mass enlargement in your actual testicle area. You can have scrotal heaviness, and you can have your groins aching. Those are pretty much all signs. But I guess the diagnosis of testicular cancer is made after a focus in history and physical examination is completed. But you really can't give a for sure diagnosis without tissue samples. So that being said, let's talk about management. You do have a couple of treatment options. Surgical resection. So you can go ahead and have surgical resection done. And you might have to have it done near the lymph nodes, depending on where it's located and how much is actually spread. But if you catch this early enough, surgery alone could totally prevent it. And this is totally curable. So, it's definitely important that if, you find out you do have it, just get it taken care of, because it's really easy to treat. But, radiation therapy is also one of the options that they use. But if caught early enough, simple surgical intervention would be perfect. Prostate cancer is malignancy that basically affects men later on in their years. And I guess the median age diagnosis would be at 72, which is, wow, that's pretty up there. And I guess 1 in 6 men are actually likely to develop prostate cancer in their lifetime, and African Americans have a higher incidence when it comes to prostate cancer. Interesting, though, the exact etiology isn't exactly well known. So they don't really know how it kind of all works and manifests and, affects the body overall. But an inherited DNA change could be a factor in why people actually do wind up with this cancer. And I guess it happens in about 5 to 10% of these prostate cancer patients. So that's pretty interesting. A majority of the prostate cancers develop in the prostate cells, which are actually used to produce fluid, and they're referred to as adenocarcinomas. But one interesting thing to define as far as risk factors is diet, high animal fats, obesity, tobacco use, alcohol, and, benign prostatic hypertrophy, and even STDs. They really don't seem to have any correlation with this cancer. Which is kind of interesting. As far as signs and symptoms, early detection is key. You definitely want to try and detect it as early as you can, but of course, most people diagnose when it's late. And then again, all of the agencies that I actually govern checking for this prostate cancer really don't specify when or how or you should actually go about and how often you should go about screening it. Actually, the ACS actually doesn't even recommend or support routine screening, and this is pretty interesting. And then the PSA doesn't really have any guidelines outlining any screening also. You'll know the disease is present as far as signs and symptoms due to urinary symptoms and also maybe some blood in your urine. These are just some really key indicators that you probably should go ahead and possibly get tested. There are some tests that you can go ahead and do. You can go ahead and do an elevated screening, is what they call it, as far as the PSA organization. You can also do a transrectal ultrasound and then multiple biopsies of the prostate gland. You can go ahead and see exactly what's going on. As far as management, it depends on the stage, the grading of the actual cancer. Pretty much the same, except for this cancer uses something special called a Gleason scoring system, which they kind of use basically to see exactly what stage you're in. And depending on what stage you're in, you can do, the hormone therapy, the chemotherapy, and then there's cryotherapy. So there's different options that you can go ahead and do. But one interesting thing is chemotherapy is actually not recommended as a standard for prostate cancer. They actually would like you to do more of hormone therapy. So that's pretty interesting. Alrighty, getting pretty close to the end here, guys. Bear with me. Non-melanoma skin cancer, most common cancer in the United States, and there's two types. You have your basal cell carcinoma, and you also have a small cell carcinoma. Also, these are the most common types of non-melanoma skin cancers. And the cancer is actually more likely to develop in skin-fair people, which isn't surprising because the darker you have, the more protection you have as far as your cells getting damaged from radiation from the sun and things like that. So yeah, fair skinned people would have higher incidence of actual cancer. It will develop as far as signs and symptoms. It's kind of like a chronic deal here. It'll develop in the skin, and it's due to basically too much sunlight exposure. And it could present as almost like sores in areas of the skin that just do not heal. And they're pretty like waxy and shiny. These are just kind of indicators for both the basal and the small. Now, as far as, let's get a little bit more specific as far as the small cell carcinoma. It could be masses in areas of rough skin. So that's kind of a key indicator that you might have small cell carcinoma. But of note, which is kind of interesting, the basal cell carcinoma rarely spreads or metastasizes, which is awesome. But as far as the small, you're kind of screwed. It's going to go ahead and spread. Let's talk about management. Again, staging. This doesn't change. You're going to have to go ahead and stage and find out where it's located. And then once you find out where it's located, you can find out, okay, how big is it? Is surgical intervention necessary? Is chemotherapy necessary? And you have different modalities that you can go ahead and approach depending on where the actual site is of the cancer. One of the next cancers we're going to tackle really quickly is melanoma. This type of cancer that develops within the melanocytes. And these are just your cells that produce melon, basically. As you know, melanoma cancer is deeply pigmented lesions, basically. They can be red, pink, purple, blue, white, and different variations. Interesting, the highest incidence of Caucasians, as far as how this disease would occur, pretty much basically the incident would be in Caucasians, and they're 30 times more likely to develop this than African Americans. And again, that just has to do with, again, African Americans have that darker complexion, and their skin will go ahead and reduce the amount of sun exposure. Now, treatment is approximately 1.5 billion annually. Now, that's pretty interesting. As far as warning signs, you need to look for changes in colors of your existing moles, and there can also be bleeding and intense itching. And again, your mole sizes can start varying. That's something you definitely want to look for. As far as diagnosis, it relies on basically the high index of suspicion. There's an ABCDES system basically described by the American Academy of Dermatology, which kind of classifies these signs and symptoms. Though a definitive diagnosis is determined basically by a pathological review of a biopsy, either a punch or excisional. Treatment doesn't really change. It's going to be basically the same as all the others. It depends on the stage and basically where the lesion actually is. So that's not going to change. Alrighty, so oral cavity cancers, that we're going to talk about next, and they basically develop an actual oral cavity, which includes like the lip, the mucosa, the oral tongue, the hard and soft plates, your gums, your mouth, your tonsils, your tonsil pillars. It's kind of interesting. Oral cavity cancer actually contributes to more than 6,000 deaths per year, and it occurs in individuals normally older than 45. One of the risk factors would be, of course, tobacco smoke, chewing tobacco, cigarettes, pipes, smokeless tobacco. But newest research has also shown that HPV has a role in the development of oral cancers, which is pretty interesting. As far as signs and symptoms, it can be detected pretty early. You want to look for changes in whatever dental appliances you're using. Also, you want to look for sores on your lips that don't heal, masses on your lips, and like kind of whiter red patches on your tongue. Though a definitive diagnosis really can't be made until there's a biopsy of the suspected tissue. As far as management, still the same, depends on how far it's spread, on the size. If you're like a stage 1 and 2, you're most likely going to be treated with surgery or radiotherapy. But when you get into the 3 and 4 category, you're pretty much going to be looking at surgery, radiation, along with chemotherapy, so a lot more involved. Great. So, what we discussed many types of cancers. Lungs, which is one of the most common between men and women. And then you have testicular, which isn't really common at all. And of course, skin, which is one of the most common ones that people kind of run into, especially if you're Caucasian. So we learned a little bit about different types of cancers. And again, and what I would like is for Abby Smith to be able to discuss this cancer, share my presentation to others, and give them a quick overview of exactly what these cancers, which are so commonly occurring and uncommonly occurring, actually do, how we treat them, and what can be used for early diagnoses. And hopefully this information will, of course, help her along with other families in the future to give them that overview that they need. Should be simple enough so that they can regurgitate the information and help other people as far as with making decisions and discussing different cancers with each other. So thank you for looking at my presentation. Thank you for listening. Hope you liked it. Hope you like it too, Abby. And I hope it all works out for you. Thank you.